Clear? Now, Zia has helped us to be the model. So we find Zia. Please lie down. See, first important thing. Burns patients, you can see the burns patient either in the hospital, right? In the ICU, in the hospital ICU, or you see the patient in the burns unit, or you see any burns patient in post-surgical. After surgery, there will be a ward, post-surgical ward. Or sometimes after he would have gone to 2-3 hospitals and then he may come to you in the outpatient department, physical therapy outpatient department, or in rehabilitation centers. Okay, so you can see burns patient in different stages. Understand? Sometimes in the ICU in a very critical stage. Sometimes in a post-surgical ward after skin grafting, after Z-plasty, after HCAP, many type of surgery. Clear? Sometimes in a outpatient department with after healing and healing has started because the outpatient department is near to his house, so he may come. Or sometimes if you are working in a rehabilitation center, you can see some patients with joint contractures and deformities. Understand what I am saying? So you may see burns patient in a different stages, and your treatment will also differ in each stage. Your importance to the treatment will change in each stage. Clear? Now today we will see if you are going to see a patient, a burns patient in a hospital where initially from the emergency he will be shifted to ICU. Okay, the patient is in a ICU. What is ICU?
Intensive care unit.
Intensive care unit. Why it is called as intensive care unit? Means there will be a intensive care, that is more concentrated and specific care with all the facilities. And moreover, in intensive care unit, the ratio of the nurse and the patient, nurse and the doctor will be equal. For more example, for each patient there will be one nurse to take care, right, in ICU. Whereas in the ward, how it will be? For 2-3, one ward, some 2-3 nurses will be there. So the attention will be more in the ICU, intensive care. Okay. Now, as a physical therapist, I am a physical therapist. So now I got a reference. I got a call from the hospital to the department. Dr. Radha, we have a burns patient in the ICU. Kindly come and give physiotherapy or physical therapy. I will get a reference. Okay. So what I will do? Immediately I will go and I will go treat the patient. No, never. So if I get the referral, first what I should do? I should go and consult to that ICU person. Who is the patient? Who is the patient who has referred for physical therapy, and give the case sheet of the patient. Okay. What is case sheet? File. Patient's file, where all the details of the patient will be there. So first I will go and I will take the case sheet and I will read the case sheet of the patient. In the case sheet, we get a thorough assessment. So what are the assessments? We have two kinds of assessment. One is subjective assessment and another one is objective assessment. So subjective assessment, in the case sheet we have various pages. In the hospital you can see. In the subjective assessment we can see all the name, age, sex, occupation, right? What are the problems, everything, history, how this happened is very important for burns. The history of the condition, how this patient got burns, whether it was a trauma, accident, fire accident, or it might be sometimes suicide. You know what is suicide? Sometimes some people wantedly they will do due to some psychiatric problem or depression or anything. So they will commit suicide. So you should check what is the exact problem. So history is very, very important. What kind of burns? Whether electrical burns, fire burns, chemical burns, inhalation burns, what kind of burns. All the details will be cleared in the history. And in the history, they all are burns, but there is a difference. Why? Asking, they all are burns. Why we should see what kind of burns? Because if it's an electrical burns, sometimes along with the burns, he would have attained some other trauma, fractures also. Because he will be thrown from one part to other part. So what happens when he falls from there will be some associated injuries also. So you should check what type. Sometimes inhalation. So inhalation means more to the respiratory tract. So his limbs and all will be normal. So we will check what type of burns, what is the cause for the burns, we have to check. Then more important, the assessment made by the doctors and the nurses will be more useful for us. Why? It will give you about the TBSA. What is TBSA? Total body surface area of the bones, of the burns. How much percentage of burns is there? So the rule of 9, you can see how much of percentage burns is there for this patient. We will see that, and we have to make it in mind. Okay, whether it is a severe burns or moderate or less burns. What is the ratio? You will check. Clear? So this is about the subjective. And as a physical therapist in subjective, what is your main assessment? Because this day and age everything will be in the file. What you physical therapist should do mainly in subjective assessment? About the pain. We should take up